Good evening, everybody. Dr. Ron Weiss here, talking to you from the farm, Ethos Farm in Long Valley, New Jersey. And we are having our webinar tonight. Let's do a sound check. Can everybody hear me? Message us if you can hear me so I get an indication if... Yes. Okay. All right. Okay, we're getting yeses. You can hear me. Great. Thank you for responding. So, what are we going to be talking about tonight? Okay. Tonight we have an interesting topic. And the topic is what to expect when you go to a plant-based doctor, and how in concept is that visit different than when you would go to a conventional doctor. What generally happens which is different, and particularly different here at our Ethos Primary Care office. So I think that when I think about the main differentiating factor, I like to think about a story that I tell patients. And the story is this, that if you were the patient and let's say you're trapped in your house and you feel water dripping on your head. You're sitting on the living room sofa and water is dripping on your head, and I am the doctor. I am walking past your house and there's an open window and you start yelling, "Please, someone help me, help me." And, I hear this frantic voice. I run inside the house and I see you, the patient, sitting on the sofa with water dripping on your head. Excuse me. And you say to me, Dr. Weiss, please do something to help me. And I size up the situation. I look at you. I see there's water dripping from the ceiling. And what I proceed to do after thinking about it for a minute, think about my options. And I think, what would be best to do? To strap a cup with a string to your head or a bucket to catch the water. And, if I were to do that and you were the patient, would I have solved your problem? Well, in the short term, yes. You wouldn't be getting wet anymore, which would be a nice thing. Maybe you'd stop yelling for help. But in the longer term, I think that you as a patient would feel pretty uncomfortable because you know that I really didn't do what was necessary to find out what the cause of the dripping water is. And did I go upstairs to see if there's a broken pipe? No. Did I examine the roof to see if there's a hole in the roof and rain is coming in? No. Did someone leave on the bathtub and is it overflowing? Is the toilet stuffed up? Is the toilet overrunning? I didn't consider any of these causative possibilities. And because of that, the process that is causing the dripping continues to march on, and probably you're worrying in the back of your head that sometime in the future, if I continue to sit here, the ceiling is going to buckle and is going to crash in on my head. And I tell you this story because I think that plant-based medicine considers the causative problems. A good doctor practicing plant-based medicine considers what the causes are of a patient's illnesses when they come in, and then addresses the cause. And in doing so, you can find the solution to the problem and wipe it out, instead of continuing to string along the patient in a chronic state of disease with drugs, which is called disease management. So let's talk about a few. I was thinking the other day of the top medical complaints that would come into a primary care doctor's office, and why don't we look at the cause of each one of these complaints, and then we'll compare how a conventional doctor would treat it, the problem, versus a plant-based doctor. Okay. Well, let's take a look at high blood pressure, hypertension. What is the cause of hypertension? The real cause of hypertension is non-compliance of your arteries or vascular system. So you have the cardiovascular system consists of a pump, a mechanical pump, which is the heart, and it pumps fluid, which is blood, continuously through the series of pipes, which are the arteries and the veins, and to serve your organs with blood, nutrient-rich blood. So what happens in high blood pressure is, as the system of pipes becomes increasingly clogged up, degraded, loses their elasticity, because normal and healthy arteries have a layer of elastic fibers, and every time the pump pushes, the arteries expand to receive the rush of blood, thus lowering the pressure within that pipe. So as time goes on, you lose your elasticity, the pipes deteriorate, they become leaden, stiff, and clogged up. Well, if that happens because you're eating a standard American diet or an unhealthy diet, as the pump meets increasing resistance, it must generate higher pressures to push the fluid or blood through the lines, and that's hypertension. So what we would do, a plant-based doctor or a doctor who's concerned with removing the problem, is he would address why the patient's arteries are becoming stiffened and clogged up and damaged. And as a lot of us who eat plants know, we know the reason why that is. That's due to poor diet. So we must fix the diet. And when we fix the diet, high blood pressure is one of the easiest things to overcome without drugs. So what would happen in a conventional doctor's office? Well, you would walk in, the doctor would diagnose that you have high blood pressure. Generally, there is some attempt by the average conventional doctor to talk to the patient. They'll tell them, not to stay away from salt, lose some weight. But the dietary advice is usually not that specific. Maybe have a Mediterranean diet, eat more vegetables. But in the conventional sense, certainly not to avoid the real problems, which are animal foods and processed foods that are causing the arterial degradation. And so what generally happens for most people is they end up being put on drugs, high blood pressure pills. The high blood pressure pills do artificially lower the pressure within the pipes, but unfortunately they do nothing to stop the continued and progressive clogging of the pipes and the constriction, the non-compliance, or the increasing stiffness of the arteries. And so, this is why as soon as you stop taking the blood pressure pill, the next day your blood pressure will be just as high as it ever was. Let's look at diabetes. Okay, so what is the cause of diabetes? Again, we're looking for the cause, and we're looking to address the cause. Just like, where is the dripping water coming from? Check it out and then remediate it. So, most conventional doctors and even endocrinologists still believe that the cause of diabetes is, or diabetes 2, adult onset diabetes. And the best way to intervene is to tell the patients to reduce their carbohydrate consumption. And that if you eat too much grains and rice and things like that, that would cause your sugars to be elevated. We now know that we've known for a number of years that really is not the cause of diabetes. The cause of adult onset or type 2 diabetes is saturated fat that comes in all forms of animal foods. The saturated fat gets inside to the inner workings of our cells, particularly the profound beds of muscle cells that we have, and it prevents insulin from acting to allow sugar, which is the fuel our cells burn, to get into the cell. If sugar cannot get into the cell, it starts to rise in your bloodstream, and then you have elevated sugars. What is the best way to attack the cause? Stop eating animal foods that contain saturated fat. And the saturated fat will clear out of the intracellular or inner cell space, and then insulin will be able to allow sugar into the cells. And here's another thing, that this saturated fat is also toxic to the insulin-producing islet cells. Those are the pancreas cells that make insulin. And so little by little, if we kill off enough of these cells in the pancreas that make insulin, we have reduced amounts of insulin. So by avoiding these animal foods, again, we can reverse diabetes. Okay. The conventional doctor, how would he handle the diabetes? Tell the patient to avoid, sugary drinks, a lot of carbohydrates, maybe to eat lean meats, chicken breast, salmon, but that really doesn't. These things cause diabetes, and then eventually you end up either on drugs to lower the sugars but not impact your diabetes cause, or insulin. Okay, let's take a look at high cholesterol. So, what is the cause of high cholesterol? For most people, it's eating cholesterol. Plants do not make cholesterol. Animals make cholesterol as part of their physiology. We make it, we're animals. And when you eat animal foods, you're eating cholesterol. So, there are some other things too. Being overweight causes your cholesterol usually and many times to be elevated. But for most people, it is the consumption of cholesterol. So, we tell people to stop eating these fatty and cholesterol-laden animal foods and eat plants that are low in fat and don't have cholesterol, and cholesterol drops. You lose weight. You lose the visceral fat and the body stores of fat if you're overweight that are made out of triglycerides. Triglyceride is a starting material that's used to make cholesterol, and so that starting material, the amounts go down and cholesterols drop. What would happen if you go to a conventional doctor? Well, they'll say to go on a low-fat diet, eat your chicken without the skin. See, still the animal foods. Eat fish because it has fish oils in it and omega-3s, but a few people in the conventional world realize that they have a lot of saturated fat and cholesterol-raising lipids in them. And then when that doesn't work out, then you get, a statin agent like Lipitor or Crestor or simvastatin gets recommended. Okay. Coronary disease. Heart disease is our number one killer. Clogged up arteries. What is the cause of that? If you go to a conventional cardiologist, they'll tell you to have a low-fat diet, eat a healthy diet, but maybe a Mediterranean diet, because in the primate study a number of years ago, it was shown to reduce as compared to a standard American killer diet. It was this special Mediterranean diet, which included fish and olive oil and vegetables, was shown to reduce heart attack rates by 1/3. And when I remember reading this article and thinking, well, this is actually a heart attack-ogenic diet, because we know that, courtesy of our friend Dr. Esselstyn and Dean Ornish, that eating plant-based whole foods diets are basically 100% protective of heart attacks and reverse clogged up arteries. So that's what we should be doing. So what is the cause of the clogged up arteries? Well, it's a double whammy. Cholesterol does have some role in it, but really, I think the primary role is inflammation. Every time we eat foods that are not good for us, that are sourced from animals and probably processed foods, our endothelium, as Dr. Esselstyn says, the life jacket of our cardiovascular system, gets whacked. This very thin protective lining on our cells gets crevices, cracked open, gets little weaknesses in it, and then oxidized or damaged cholesterol gets in. Inflammatory reactions occur, and atherosclerotic plaques or clogs begin to build up in these linings. So no matter if you go to a conventional cardiologist, then the cardiologist will put you on all kinds of drugs like cholesterol-lowering agents, or even aspirin, or if you have angina, or maybe beta blockers or other kinds of drugs. These things do nothing to stop the damage to our endothelium, which is coming from the food. So it's important to remember to attack the cause of the assault on the arterial system by attacking the cause. Let's talk about, this is a favorite of mine, and the reason why it's a favorite is because I love to prevent problems. Best of all, in my practice as a physician, I always like to help people with problems that they have, but I feel the greatest opportunity, as that old saying goes, an ounce of prevention is worth a pound of cure, is to prevent problems from occurring. And a major thing that people come to a primary care doctor for is to prevent cancer. People do not want to get cancer. So let's take a look at the conventional doctor's visit and what goes on in the prevention of cancer, and really not much. Cancer prevention in a primary, in a conventional office setting is based on getting tests to see if you already have the cancer, like a mammogram or a colonoscopy. In the old days, it was checking PSA for prostate cancer tests. So that if you were to find the cancer early, you could try to snuff it out with surgeries before it gets out of hand. But that's really not primary prevention. That's sort of secondary prevention. The problem is already there, and you're trying to intervene as early as possible. But really, what is true primary prevention? It is preventing the cancer from getting to the point of recognition in the first place. And plant-based doctors do this the best, help the patient the best with this. How is this? Well, as adults, if you're over the age of 20, basically all of us have small cancers growing within us. They're tiny. well, I shouldn't say growing. Hopefully they're kind of arrested in their development. There may be the size of the tip of a ballpoint pen, and if we are fortunate in life, you can have a lot of these tiny little specks of cancer, but they never really get to grow larger than that pen tip, because in order to do so, they would need to hijack a blood supply to fuel their growth. And what would cause them to hijack the blood supply? Well, when these tiny little tumor points begin to elaborate a hormone, which is called VEGF, Vascular Endothelial Growth Factor. This is a hormone that goes and grabs nearby capillaries, drags them over to the tiny little ball of cancer cells, and then the cancer is off to the races. Can become larger, start metastasizing. So what causes these little tiny infant tumor collections to do that? Well, as Colin Campbell elaborates in his China study book, and with all the work he did with casein, insulin growth factor type 1 is an example of a major reason why cancer cells take off and grow into tumors. And the consumption of animal proteins is a major inducement to our own bodies making insulin growth factor type 1. So avoiding foods that come from animals prevent our bodies from making this cancer fertilizer. And then it goes a long way towards preventing these tiny cancer foci or specks from blooming into full-grown cancers. Here's the other thing you can do. Eat a lot of plants. Plants have tens of thousands of wonderful phytonutrients, or they're also known as, many of them are anti-angiogenesis or anti-blood vessel growing molecules in them that lock on to and prevent cancer cell growth. So by eating a diet of whole unrefined plants that's very varied, with a lot of greens and all the powerful plants like the allium, the garlic, and the onion family, and the blueberries and the dark berries, and all the things that we know are great, you're flooding your body with a lot of these anti-cancer molecules. And basically that's the best way to prevent cancer in a plant-based doctor's office. So I think I've done enough talking. We will see if there are any questions people want to ask. Someone asks, do you do specific testing for an individual to check levels in the blood, such as vitamin deficiencies, beyond regular annual physical blood tests? Sure. We check a number of items in the blood. We always check for important vitamin deficiencies to make sure that you are, especially at B12 and other related vitamins and metabolites, to make sure that people are not deficient. We also like to check for inflammation in the blood, because inflammation is the basis of chronic disease. All the diseases of aging, like coronary artery disease, we talked about the inflammation that whacks the lining of our arteries constantly. It's the cause of cancer. It's the cause of inflammatory process in amyloid and deposition, in Alzheimer's, in autoimmune diseases, even in obesity. So yes, so we check a lot of things. We check cardiac risk tests, and sometimes we check special fancy cholesterol tests. Yes, we check usually more than the standard, average chemistry, complete blood count, and cholesterol. I see Joanne is saying, is anyone else having difficulty with the connection lagging and hanging? I keep missing a lot despite reconnecting. We have our engineer this evening here, Bhavin. Do you have any advice for Joanne?
Refresh the page.
Joanne, try and refresh the page. Otherwise, it may be your internet connection. If there's anyone else, just let us know if you're having problems. How does one know if they are varying their diet enough? You need to eat, as many. There are different molecules in every kind of plant, and you should eat as many different plants as you can, as many different combinations. I think of it like, because I'm a musician and I played for many years in an orchestra, you can't have a good sounding symphony without the 80 different players in the orchestra, and you have to get them all together. Just the violin section shouldn't show up, or the oboe section. You need to have them all playing. So all the different categories, the cruciferous vegetables and the berries, and they need to all be there. And it should be on a fairly regular daily basis. Let's see. We have someone asking, can I eat too much soy? Well, I guess it's possible to eat too much of any particular item. We have seen, there have been deaths of people from broccoli, death by broccoli. People have eaten, I remember reading about a man who ate about more than a crate of broccoli a day. It's possible there are sulfur containing the same anti-cancer agents, the isothiocyanates, that prevent cancer in broccoli. They can also kill you and cause you to go into liver failure. So unless you're doing something extreme or crazy, no, you can't have too much soy. Soy is a wonder food. It has genistein, which is a plant, it's called an estrogen or plant hormone, which does wonderful things for both men and women in preventing and reversing disease. So it's good to have soy every day, if possible, especially for women, especially regularly for little girls. We know that the best way to have soy help to prevent breast cancer is to start when you're a girl, and to have soy regularly. That can, from a young age, before menarche or before your menstruation begins in childhood, just by having regular amounts of soy. Population studies have shown that you can, just from that one act alone, you can reduce a woman's lifetime chance of getting breast cancer by 25%. Okay. Do we treat children? We do treat children. I have children, and I've been treating them for a number of years, and thank God they're doing wonderfully. Yes, we do treat children. With lifestyle, the treatment usually flows through the parents, because we have to get the parents on board with the parents act as being the directors. In a regular pediatrician, if a child needs treatment for something, you give a prescription for an asthma inhaler, or you give a prescription for an antibiotic, or you give a prescription for an allergy drug or an eczema cream, something like that. And then, you fill the prescription and then the parent administers it. But because we try to avoid medicines if at all possible, not that I would never prescribe them, but it's definitely my second choice or third choice. We work with the parent to change the child's primarily food, but also other activities like social activities and physical activities to really change the course of their medical problems. So yes, we enjoy taking care of children. Any other questions? Okay. how do we make sure we are getting enough calcium? Okay, by eating calcium-rich foods like the dark leafy greens, like collards, like beans, have a lot of calcium. And as long as you eat, these foods every day in a regular way, you will be getting enough calcium. I don't think, I think that, some degree of regimentation to make sure you're eating well is necessary. But as long as you're doing that, you will get enough calcium. There's more than enough calcium. You don't need to drink dairy products or eat animal foods to get calcium. Next question. Someone asked, is it best to locate organic produce? If I can't get organic, is it still okay to purchase non-organic produce? This is one of my favorite questions. So plants are so powerful that even if you were to eat plants that have been grown and covered with cancer-causing pesticides and insecticides, which, by the way, most agricultural chemicals are. They are endocrine disruptors, carcinogens, but they are so powerful that the plant molecules, those same molecules I talked about before that can prevent cancer in us, they are capable of doing wonderful things for us. So yes, if you have no choice, eat the conventional produce, eat that. I'd rather you have conventional produce with pesticides. I'll choose that any day over an organic chicken, or grass-raised beef, or free-range chickens, organic chickens. Pick the biocide-laden produce. However, of course, there are enough reasons in the world to get cancer, right? So why expose yourself unnecessarily to cancer-causing agents? Number one. Number two, there is evidence now that even if we're consuming these pesticides, they may not directly affect us in our lifetime, but they may, when we reproduce, they may ride down through our eggs and sperm into our children and grandchildren, and they may cause things like attention deficit disorder, autism, obesity, diabetes, or cancer in our progeny and their progeny. So that's a scary thought, and we now have evidence of this. This is called the field of epigenetics. Just for that reason alone, I try to avoid these chemicals. And the other thing is that you have to remember, conventionally raised produce is very detrimental to the soil, and we need to save the soil in this country. It's killing off bees, it's killing off monarch butterflies, it's killing off birds, it's killing off the world. So, I have 2 young kids. I want something to be here for them and their children. So that's why on our farm, we don't use any chemicals at all, because we want to try and restore and preserve the earth. Does your practice offer a plant-based nutritionist? Absolutely. So our lifestyle director, Asha Gala, is one of the highest level plant-based people I have ever met. And she's been practicing a high-level plant-based whole foods life for over a quarter century now. And she's very experienced. We have, when we need a high-level evaluation, Asha evaluates people's diets in detail, and then we make our recommendation. She also assists me in doing our lifestyle medical evaluations. That is a special kind of visit that we have where people can come in, and I evaluate them medically, and then Asha evaluates their lifestyle needs, and one of those, of course, is the food, the diet. Regarding essential amino acids, if one is eating a well-balanced and diverse plant-based diet, are we going to be missing anything? No. That old myth, this is why there's this myth or misconception about complete proteins. In the old days, and this has been blown apart many years ago, they used to teach in nutrition school that falsely that only animal proteins are complete, and that somehow if you eat plant proteins that come from plants, you're missing some essential amino acids. That's completely false. By eating whole unrefined plants, you can get all of every single amino acid that you need to build your own proteins, and you can live a strong, healthy life. Okay. Someone wrote, your thoughts on oxalates in greens like parsley, spinach, and kale. Can I overeat? Let me see what that says. Oh boy. I think I can't read the end of it, but probably. So there are concerns with, this person obviously is concerned with oxalates. Oxalate is a mineral coming from oxalic acid, and it's problematic for some people. There are some people who cannot process this mineral, and it is very high in some foods, like rhubarb, and very high in spinach. Parsley has it, blueberries, other things have it. And basically, people who are prone to forming oxalate kidney stones, if they're given too much of this, it could be a problem. Now, so the first line of defense, the way I work it with these oxalates is, if we know that you have a problem with kidney stones, what I do is we transition the person first to a plant-based diet, because just doing that alone and avoiding the consumption of animal proteins is usually enough to reduce or eliminate the formation of oxalate kidney stones. But I have found not always, 100% of the time, it is not foolproof. And we have had patients who are extremely dedicated to eating their plant-based diet, no animal foods, and they're still forming kidney stones. And when we go to look at their urine, it's filled with too much oxalates. So on those patients, if sometimes if I'm concerned about a patient, I will check their urine over a 24-hour period and measure how much oxalates do you have when you're eating the spinach and the beans and the parsley and the rhubarb and all this stuff. And if it's way over, I usually tell the patients to limit these specific items and possibly to take vitamin B6 and magnesium. B6 about 50 milligrams per day, and magnesium like 300 or 400 milligrams per day, because these things have been, these supplements have been shown to help prevent oxalate kidney stone formation. Okay. Someone talks about eating coconut products and saturated fat. So coconut is one of the plants that we have to be careful about. There are not many plants that you have to really watch and have in a limited way, but coconut is one of them. And the reason why is because coconut is filled with high levels of saturated fat. And remember what I told you early on, that saturated fat is not good for us. It's not good for our lipids. Saturated fat helps to cause diabetes. It's a main cause of diabetes, type 2. So we want to avoid saturated fats, and you can do that by generally avoiding coconut products, coconut oil, not coconut water. Coconut water does not have any fat in it. So that's what I would advise. Once in a while, I do indulge. We go to the Thai restaurant. I'll have a delicious coconut curry, but it is seldom. It is seldom. I'm going to take one more question because I see we're coming up upon the witching hour. It's 8:43. It's not midnight. Okay. Someone asks a question about epigenetic testing. So, yeah, for practical clinical purposes, we do not. There is no epigenetic testing that I'm aware of. The science of epigenetics is basically in a research mode right now, and it's not that old of a field. Maybe it's about a decade or decade and a half old, and basically the idea is that molecules from our environment, from the external environment, clamp on to our DNA, and then start controlling the DNA is the instruction booklet that tells our cells what to do and how to act, and these molecules, which are contaminants generally in our environment, and they can be pesticides, like I told you, can then start causing our DNA to do things that we don't want them to do and cause mutations further down the line in our DNA. So there is no, other than research analysis of these molecules, there's really no practical way of us doing it currently in humans that I am aware of. Regular patient testing. And then the part B of this question was, how about analyzing the health of your microbiome? That's my favorite topic, of the gut. And there are services out there. A popular one, I believe, is called Ubiome, that for a number of hundreds of dollars will do some basic analysis of your microbiome. But quite frankly, I'm not sure. In general, my policy in ordering tests is I order tests if I ahead of time know what I'm going to do with the results and I can do something about the results. And at this point, we don't really, as far as getting microbiome analysis at a very high level to be able to identify exact pinpoint disruptions in bacterial communities that can cause diseases, and then we can fix those disruptions. We're not there yet in a patient care model. We're starting to get there a little bit in research. In microbiology, we're beginning to find, this patient with rheumatoid arthritis, they have these kinds of bacteria which are awry. But then how would we go about fixing those bacterial disruptions? We're not exactly sure, other than eating whole plant foods. And I think that's why across the broad spectrum of diseases, chronic diseases, including most autoimmune diseases, the most powerful treatment is whole, unrefined plant foods. Because when you eat those foods, it rearranges and optimizes the gut microbiome and rebalances the communities of bacteria to a healthy level. So, there are a lot of commercial services you could get, but I'm not sure of what clinical benefit they are of at this time is not clear to me as far as analyzing the microbiome of the gut. Okay, well, thank you so much for joining us this evening. We have one of these free webinars every month on a particular topic, and we look forward to having one in June. We haven't figured out exactly what we're going to talk about, but I'm sure it will be just stunning, very exciting. that we may even have a guest star with me. So tune in, watch out for our Facebook page. We always make an announcement on Instagram too. And if you signed up for the webinar jam, we'll send you an email so you'll get information about when our next exact date and time of our next webinar. So from the farm, I bid you adieu. Have a wonderful evening, and to everyone's health. See you next time.